Assalamualaikum everyone, welcome back to this channel. So this is me Alia Waheed, and in this video we are going to start the previous chapter of which we are discussing about the diseases which are causes in our respiratory system. So first of all, we have covered the cough. We have discussed what are the drugs that should be used in the cough, and second lecture is on about the drugs of the asthma. So we have discussed about the asthma. We have discussed that what happens in the asthma. So in the asthma, the bronchoconstriction is happening, and we have discussed that what are the symptoms of it. Now we are going to discuss the normal physiology of your respiratory system. Actually, normal physiology of respiratory system is very important to discuss, because when you know the normal physiology, after that you will clearly understand what is the pathophysiology of respiratory system. So therefore, let's take this concept, then after that we will move toward the pathophysiology. So normally what happens in your respiratory system, you know that in your bronchioles the smooth muscles are present, and they are normally undergo a process of bronchodilation and the process of bronchoconstriction. So if your lung is normally undergo bronchoconstriction, then it means all the person who have bronchoconstriction in their bronchioles, they are asthmatic? No. Why? Because in your lungs, in my lungs, whether we are not asthmatic patient, but we our bronchioles undergo the constriction. It doesn't mean every person who has bronchoconstriction has asthma. So this include in the normal physiology. Actually, what happened, some inflammation happens which makes your bronchioles to constrict. So it doesn't mean every person who has bronchoconstriction has asthma. So let's discuss what is the normal physiology when your bronchioles undergo the constriction. So in the first case, we will discuss the bronchodilation. The first case is when you are in the stress. Yeah, you are in a state in which you have a lot of emotions in you, and you are in a stress which you are fighting with someone, or you are doing some exercise, some very physical activity. So whenever you are in these activities, your sympathetic nervous system is working. Now whenever your sympathetic nervous system is activated, it is going to cause the bronchodilation. So at that time bronchodilation happens and your secretions are increased. Okay, but now how this process occur? Okay, it doesn't happen that some kind of magic is happening and your bronchioles are going to dilate. It never happened. There are some receptors on which the signals goes, and the activation of receptors happens, and then a particular mechanism is happening, and then after that the bronchioles are going to dilate. So let's discuss its mechanism. So I have drawn your lungs, so your sympathetic nervous system will go and send signals to your lungs. So from your sympathetic nervous system, the signals came and it goes to what? A receptor. And this receptor is present on your lung. This receptor is called beta 2 receptor. They are the adrenergic beta 2 receptors. If you have discussed or know about the adrenergic nervous system, then you will clearly know what is the beta 2 receptor, where they are present, what is their role. So if you doesn't know, then please go to my channel, see the video which I have uploaded about it, and then after that you will clearly know about that. Now simply in that lecture you will just think that it is a receptor which is present on the lungs. Now after the activation of that receptor, this receptor this is causing the conversion of AMP, adenosine monophosphate, and convert this AMP into cyclic AMP. Now, whenever the cyclic AMP is formed, your bronchodilation will happen. So your cyclic AMP is actually responsible for the bronchodilation. So more the concentration of cyclic AMP, more will be the bronchodilation. If your concentration of cyclic AMP is less, then your bronchodilation will be less. So actually this is the second messenger system which activates and cause your bronchodilation. But let's suppose now the condition of stress is passed away. Now you are not in physically active mode, you are not exercising, you are stopped your exercise or physical activity. Now your lungs have to get back to the normal position. Now your bronchioles will get back to your normal size. So how they do, because now they have to degrade this cyclic AMP. So how they will degrade? They will degrade by an enzyme which is called as PDE4 enzyme. This is the phosphodiesterase enzyme. This enzyme is responsible for conversion of cyclic AMP again into AMP, which is the adenosine monophosphate. So when it again convert, now your bronchioles will not dilate. Okay, now it's mean you are again in a normal condition. You are not. You have no sympathetic nervous system. Now you have know that we have another kind of nervous system which is called as peripheral nervous system. And peripheral nervous system work in a condition when you are in the rest. Now you have no physical activity, no exercise, now you are completely bed rest. Now in the case of rest, this nervous system activate, which is the peripheral nervous system, and it is responsible for the causing you bronchoconstriction. Now your bronchioles are going to constrict. The bronchioles which are present in it, now they are going to like that. Now they have very narrow space between them. But how the bronchoconstriction happens? Because there is another kind of receptor which is present on your bronchioles, and these receptors are called as M3 receptors. M3 are the muscarinic 3 receptors. So muscarinic chapter I have discussed it in the previous lectures. If you don't see it, then go visit to that lecture. After that, you will clearly know what are the M3 receptors and where they are present. So in this lecture, I will shortly explain to you that M3 receptors are the muscarinic receptors on which the acetylcholine or the muscarine can bind, and they have the M3 have a specific location that it only present on the various lungs, it present on various glands, and also it present on the stomach. So it has various role, but now we are saying that M3 receptor which are present on the lungs, how it is doing. Actually, your peripheral nervous system send a nerve to that M3 receptor. From that, this nerve ending acetylcholine is going to release. Now, this acetylcholine will bind to M3 receptor, and the M3 receptor will activate itself. Now, after the activation of M3 receptor, what will happen? The phospholipase C is activated, and your phospholipase C is going to activate IP3, which is called a inositol phospholipase 3, and it also produce AGD. AGD. This is another kind of protein which has role in this second messenger system. So actually, this is also a second messenger system, but it is the other type of second messenger system. Now your inositol monophosphate, this is going to increase the concentration of calcium. This is the intracellular calcium concentration, so it will allow more and more calcium to move inside a cell. And whenever the calcium influx happens, mean the calcium move inside a cell, the muscular contraction happens. So this is a key point, you have to keep this in your mind. So whenever someone call you that influx of calcium happens, so you have to ask that the muscular contraction happens. So as this is happening inside a bronchiole, so the muscles of bronchioles, which are the smooth muscles, they are undergoing the contraction, and as a result the bronchoconstriction happens. And always you have to remember, whenever the bronchoconstriction happens, the secretion of mucus from your mucus gland is going to decrease. But whenever your bronchodilation happens, the secretion of mucus from your glands is going to increase. So whenever the bronchioles are dilated, secretion of mucus increases. Whenever they are constricted, the secretion of mucus is also very less. So this is the difference that you have to keep it in your mind. Now after this, we are going to see the pathophysiology of asthma. Now we are going to see some pathophysiology of asthma. So in your pathophysiology of asthma, your asthma is consist of two phases. So the first phase is the intermediate phase and second is the late phase. So what are happening inside the intermediate phase, or what is happening inside the late phase? Now let's discuss it. So the intermediate phase, we have as discussed this phase in the previous lecture. Now again we are going to modify this, and after that we also discuss the in what things are happening inside the late phase. As a result, the asthma is happening to you. So first case is the immediate phase, that immediately after the attack of allergen, what is happening inside your lungs. So whenever after the entering of your allergy or allergens, what is happening, these allergens will attach themselves with the helper T cell or dendritic cells. So various dendritic cells and helper T cells, they have receptors on it. Like the receptor which is present on the helper T cell is called that helper T receptor. So HT receptor R, okay? And various dendritic cells, they also have receptors, they attach to them. After that, they are going to produce a kind of a lymphocyte. This is called as lymphocytes. This is a type of white blood cells. Now it has two types further, Th1 and Th2. Th1 has no further role in the asthma. Th2 has important role in causing the asthma. Like this, Th2 will cause the release of various important factors which are playing important role in causing the asthma or in causing the inflammation of your bronchioles. It is going to release three interleukin factors. What are these factors? These are interleukin 4, interleukin 5, and interleukin 13. So in the previous lecture, we have only discussed about interleukin 4 and interleukin 5. But here I have added another interleukin, which is the interleukin 13. Now let's discuss all of their roles. So first of all, let's discuss about the interleukin 4. Now your interleukin 4 will going and causing the activation of your plasma cells, and you know that the plasma cells are playing important role in the production of a antibody. And which antibody? IgE antibody. So as a result, IgE antibody will form, and this antibody will attach on the mast cell. Like this is a mast cell, on it the IgE antibody is attached. Now after this attachment, the mast cell is going to burst. Now after the bursting of mast cells, three important chemicals are released. So now these three chemicals are released: histamine, prostaglandin, and leukotrienes. So you know histamine is very important agent for causing the inflammation. Prostaglandin is causing the inflammation and causing increase in the vascular permeability. And leukotriene is the one of the most important inflammation causing agent. So these chemicals are released by the mast cell. Actually, mast cells has various kind of granules in them. So whenever the degranulation of mast cell happens, these chemicals are released. Now this is the mechanism which is caused by interleukin 4. Now what things are happening due to interleukin 5? Now your interleukin 5 will go to activate your eosinophils. Eosinophils is a type of white blood cell which is present in your body, and your eosinophils are going to release histamine, proteases, and bromelain. Histamine in causing the inflammation, proteases are the enzyme which cause the breakdown of protein of the membrane of your bronchioles. So whenever the membrane of bronchioles break down, it will cause the inflammation. And bromelain is a important factor which is causing the inflammation in your bronchioles. Actually, it acts as a chemotaxis or chemoattractant. It means it is going to attract different chemicals, different kind of immune cells. It will attract eosinophils toward itself. It will attract various kind of neutrophils, various kind of basophils around itself. So when the more immune cells gather here, more the inflammation happens at that side. Last factor, which is the interleukin 13, it is also enhancing the eosinophils process, so it enhances their activation and causing the production of these chemicals. Now we have covered all about the immediate phase. Now we are going to start the late phase. So what is happening inside the late phase? The intrafiltration of Th2 inflammatory cells. Now these are the Th2 inflammatory cells. They are going to enter into your lungs or into your bronchioles. Now they are stimulated by various kind of mediators. What are these mediators and what are their roles? Let's discuss that. So here are the first mediators which are released. These three mediators: leukotriene, cysteine C4, adenosine, and nitric oxide. So these chemicals are released, in which adenosine is most important. Adenosine is a endogenous protein which is released, which is present in your blood. Actually, it will bind to M3 receptor on your bronchioles, causing the bronchoconstriction. So, and while the other, like leukotriene, cysteine C4, this is a type of leukotriene, and nitric oxide, the three chemicals are causing inflammation in the airways. So the next mediators which are used are two mediators which are eosinophils major basic proteins. They can be abbreviated as EMBP. And the second mediator is eosinophils cationic protein. This is ECP. So these two mediators are used. They are actually damaging your epithelial cells. So and after this damage, they are causing airway hyperactivity or hypertrophy. So actually I have drawn here the bronchial membrane of a asthmatic patient. So as you can see here, the this is the membrane of the asthmatic patient, and I am also drawing here the bronchiole of a normal person. So this is the bronchiole of normal person. Okay. So both of them has great difference. The first difference is that the membrane of normal person is very thin in nature, but we can see its size, it is very large in size. So actually the hypertrophy is occurring, that increase in the muscular size is happening in a patient who have asthma. Why this happens? Because of the epithelium damage or because of the inflammation. So actually in this membrane, various kind of inflammatory cells are present. These are eosinophils, basophils, neutrophils, various kind of leukotriene, C4 cells, nitric oxide, various kind of inflammatory cells. Due to their presence, this muscular size is increased. Second is the narrowing of lumen is happening. As you can see here, it has greater lumen, that easily the air can pass through that space, but here the space is very little, that there is very difficulty for the air to pass. And here the mucus is in less amount. Okay, but here as the space decrease, the mucus is accumulated here, which is causing the increase in the inflammation formation, and various kind of mucus plugs are formed because now the mucus is going to stuck here and cannot able to move. So therefore mucus plug are going to form here. And also endothelial cells which are attached to this membrane, they also go to shed off, and they also present in the mucus. But here this is very normal, this is have a lot of air here it, and they can easily breath out. So this is the difference between asthmatic patient bronchiole and the bronchiole of a of a normal person. Now we are going to see how to diagnose the asthmatic patient, or which by which test we are going to detect it. So here I have written two tests for its diagnosis. First is the sputum test, and second is the pulmonary function test, PFT. Okay, now first discuss sputum test. Sputum test is very important, but in Pakistan, unfortunately, the sputum test is not happening here due to unavailability of apparatus. In Pakistan, only the X-ray is done, and they are going to detect whether you have the asthma or not. But actually, the X-ray is not a well-defined diagnosing agent, so it should not be used, but due to unavailability of apparatus the doctor are using it. So let's discuss about the sputum. So sputum is the hard mucus in the spiral shape. So first of all, and by this test you will take the sputum out of that patient, and you will detect it, and after placing this mucus inside the microscope, you will detect some spiral shapes in them. And if you detect them, then it means this patient has asthma. Which kind of epithelium cell will be detected out, which kind of increase in the eosinophils number will be detected, and pigments are also present due to broken esophageal cells. So you will see the pigmented, and you will see change in the color of mucus also. So if all of these signs are present, it means this particular patient has asthma. And if these signs are not present, it means this person is normal. Now let's discuss the second test, which is the pulmonary function test, PFT. So in the PFT, you will see a ratio. A ratio between what? Between the two important things. First is the FEV. This is the force expiratory volume in 1 second. That how much volume of air you are going to expire in one volume, and this is the forceful expiration. And second term is FVC. This is the force vital capacity, that how much capacity of taking air inside your lungs. So you are going to find the ratio between these terms. You will find these terminologies, you will equate their values, and after that you will find the ratio between them. If the ratio is between the 75 to 80%, then it means this person is normal. But if the ratio is around 60 to 70%, then this means this patient has abnormal ratio. It means his pulmonary test is not normal, and he has some kind of disease, whether it could be asthma, it could be COPD. And what is COPD? This is the chronic obstructive pulmonary disease. So now we have to discover whether the patient has asthma or COPD. ठीक है? So two diseases are going to detect by this test. First disease is asthma, and the second disease is COPD, coronary obstructive pulmonary disease. Okay, now let's discuss it. Now you have two kind of patients in front of you. The first is the symptomatic patient. It means the patient who have the symptoms of asthma, but now you are going to again recheck that whether the patient has asthma or not. You are going to do a final or confirmatory test. And the other patient who is asymptomatic, means this patient has some kind of inflammation in bronchioles but showing no symptoms. So you have also find that whether the patient has asthma or not. Now first discuss the case with the symptomatic patient who have symptoms. You will give a bronchodilating drug to that patient. You can give any bronchodilating agent to that patient, and the most important bronchodilating drug is SABA. What is SABA? This is the short acting beta 2 agonist. Now you are going to give beta 2 agonist, and you know I have explained in this lecture that beta 2 receptors are present on the lungs, and they are playing important role in bronchodilation. Now in the patient who have asthma, they have bronchoconstriction in them. When you give bronchodilating agents to them, they feel relief in them, their symptoms are going to decrease. Now after this drug, you will again take PFT. What is PFT? This is the pulmonary function test. You will again find this ratio, and after that what you are going to see, now you will observe some kind of improvement in them because they have bronchoconstriction, and you have give bronchodilating drug to them, so therefore they will show you improvement. Now, how much improvement? If they show more than 20%, more than 12%, mean they have the abnormal ratio of around 60. The abnormal ratio is around 60 to 70. Let's suppose the patient who stand in front of it, his ratio is 60%. Now 60 plus 12, it will become 72%. So now after taking the drug of beta 2 agonist, the improvement occur around 72%. If the improvements occur and his ratio becomes 72%, it means the patient has asthma. It's mean his bronchioles are constructed. When you give him bronchodilating agent, his ratio improves. First his ratio is 60, now his ratio is 72%. It means he has improved, it means he has asthma. And if you give them beta 2 agonists, he will treat it out, he will go perfect. But if his ratio is less than 12, mean minus 60 minus 12, it will becomes 48%. So it means that patient has COPD, chronic obstructive pulmonary disease. So this was the major difference, that if a patient who have 72%, it means this is a patient of asthma, and if the patient who has 48%, it means he has a disease of COPD. Then after that you will give particular drugs to that patient. Now we are going to see the case of asymptomatic patient who have no symptoms. So here are the results of that patient. The ratio it decreased by the 20% from the total 80%. Now from 80, 20% is decreased now because you are bronchoconstricting your bronchioles. In asthma already the bronchioles are constricted. Now you again give a bronchoconstriction and causing more constriction to them. Their ratio will decrease about to 20%. It's mean that patient has asthma. And if their ratio decrease only to 5%, not 20%, only 5%, mean 80 minus 5, it's mean it is 75. So it means it's a normal person, because normal ratio is from 75 to 80%. But if the 20% is decreased from the 80%, it's mean it will become 60%. And the person who has 60 to 70 ratio, he is abnormal. This is the abnormal ratio, it means he has the asthma. But if it has 75%, it's mean this is a normal person, he has no asthma, he is normal. Okay, so this was all about the normal physiology of asthma, the phases of asthma, intermediate phase and late phase, and we also have this the diagnosis test for the asthma. So this was all about the today's lecture. Hope you like this video. If you like it, then please subscribe to this channel, like my videos, and also press the bell icon to get a notification of all the video which I uploaded. So thank you so much. Meet you soon in the next lecture. Till up, Allah Hafiz.